If you want to know what it takes or what it feels like to program for a professional CrossFit athlete, you have to tune into this episode. Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know what it takes or what it feels like to program for a professional CrossFit athlete, you have to tune into this episode. All right. Before I go into the podcast, what is new in life? What is happening before I go on to working with this incredible CrossFit athlete? What There's some exciting news. I first and foremost, I haven't shown a lot of my friends and family, but my son decided to get a black eye. So we are currently navigating a black eye. He was playing with his cousin, and the cousin lifted his head real quick. They were wrestling, and he got him right in the eye. So I'll have to share some of those photos on Instagram if you don't follow me. What else is better? I went on my wife and I went on a date night, and it has been good to get back in our routine. Our big mission was to get to when Jacob, our 1-year-old, turned 1. That was kind of our big deal to get back on a routine of monthly date night. So that was good. We finally just did that. On the fitness side, I'm very proud of myself. I have to share this. I got over the last few years, I've been inconsistent with doing muscle ups, bar muscle ups or ring muscle ups. And for those who don't know, it's just, basically go from the ground to a pull up bar and then basically bring your whole body above the pull up bar. Excuse me, your waist above the pull up bar. And I've been struggling with those. The problem was I wasn't doing them consistently. So about 2 weeks ago, we did a workout, and I got like one or two, and I've done them before, but if you don't practice them, it's really difficult. So I actually got 10 in a row, and then I got 20, and then I got 21. Now I'm not doing them consecutively. I'm taking breaks in between, but I had to share that was a big win for me. And lastly, what is happening on the Chris Garcia Academy side? If you guys don't know, or if you're not registered, I have a second event of the year. This is the Strength and Conditioning Summit. We are 7-8 days away from the event. I'm really, really excited. So for those of you attending, I'm really excited to see you. Those on the webinar coming up on Tuesday, I'm excited to see you guys too. Guys and girls, excuse me. Excited to see everyone. Nonetheless, all right, let's go on to the podcast. What is new? What is better with this CrossFit athlete? Okay, let me give you the background. And why did I do this? Okay, so over the last 2 weeks, I've been working on my slides. I've been working on my course materials and getting all the workbooks ready for this Strength and Conditioning Summit. And all I could do is go back to some of my old programming templates and some case studies. As I was writing the slides, I have some case studies that are very, very relevant for any orthopedic sports PT. I've got runners, I've got soccer players, all these other things. And I found an old template of an athlete that I worked with. And this is an incredible case. It's a very tough case. And you might get this one time in your career, this opportunity. You mess it up, you're in trouble. You won't get many of these afterwards. And this case allowed me to open up other doors within the sports realm, and I wanted to share. So this is back in 2000 and maybe 14, 15, 16, somewhere around that realm. I had an athlete. I had somebody reach out to me, and they said, "Hey, we've got an athlete coming, high profile, and they are post-op, and they have a short timeline. Would you be interested in rehabbing it?" And I said, "What's the timeline?" Same time you get a job, you get an offer, you gotta see what the realistic terms are. So they said, "You've got 3 months to build and 5 months to compete. So 3 months to build, and then 2 after that to compete." And in my head, I'm like, "Oof, that's tough." And this is post-op. Yes. Okay. What's repaired? Is this possible? And I think that's what, anytime, if you're on my newsletter, I spoke about this last week on how to do a needs analysis. Anytime that you do a needs analysis, it helps you before you even start programming. just find out what the needs analysis first. And for a lot of physical therapists, that needs analysis is based off of, what's the timeline for the surgeon, or its timeline for the physician, or whatever it is, or the athlete. And so that needs analysis looks very, very, very simple, very basic. So you ask them, what the goal is. So is there a tournament coming up or return to sport date that we're looking for? You also have to know what the training history of this individual is, and then what has worked for them in the past or not. So for instance, I've had people that I didn't do a really good needs analysis, and I put them on a barbell, and they just kept flaring up. Their low back kept flaring up, and finally we just figured out, let's just do a trap bar. But had I known that, the athlete told me afterwards, they're like, yeah, I don't do well with barbells. I'm like, well, I should have asked that. They shouldn't have told me. I should have asked that. That's really how it should work. And so as you do a needs analysis, is finding out what this person's history is, what you need them to do, what they've done well with, and what they haven't. And from there, you can look at, well, what's the timeline, what's the training age, and then what are your things that you're okay with and not. Once you do that, then you can lock in the program. Then you can start working backwards. And so for this athlete, it was a call from somebody in Colorado. And they said, hey, they're flying out to San Diego. Would you take them? So, all right, I got the timeline, 5 months, I can do it. And then what resources do I have? Do I have full independence with the surgeon? That's a big conversation to have, because are you following a protocol, or is that more of a guideline and you can push the envelope? And so every surgeon is different, right? Like, you got to gain their trust. And this one was coming from a high profile surgeon. So it was a great opportunity, because I could only imagine they're not new to professional sports. So they're going to give me a little wiggle room to be able to push the envelope a little bit. And if I know that, then I know that this is my rehab case. This is like, they've done the 50% of the actual surgical protocol, or the surgery. Now I get the other half to be able to like get them to the next point. And so I was given the thumbs up in terms of, having the freedom and wiggle room to adjust within a general time tissue healing guidelines. And the surgeon was okay with their timeline return to sport within 5 months. So here we have a bicep repair, bicep tenodesis, and this person wanted to go full throttle into CrossFit within 5 months. And so if you look at the case, it's a shoulder repair, or shoulder bicep tenodesis, and you have to look at the training age. This person's a very elite athlete. I think that prior to that, they had been to the games, I don't know, 3 or 4 or 5, 6 times, whatever that was. So they're not new to injury, they're not new to pain. And so really came down to how much can you push the envelope. So the great part is that they already had a strength and conditioning coach, and that strength and conditioning coach, anybody who knows any of my protocols or in my lingo, anybody that I work with, I always like to see who's the head chef, who's the head honcho for that phase of healing. And once you finalize that, then you kind of have no more gray areas. Now the bridge becomes who's going into the final phases, where's the technical skill come in, because I don't know technical skill, I just know programming to a certain point, and then they can take it over. So once I lock in who's going to take over that season or that phase, then it's very easy. Then you have full throttle, the surgeon's giving you clearance, and then the strength and conditioning coach has said, hey, they're all yours. I'll just work on, programming and numbers. And this is where I learned a lot from strength and conditioning coaches as I navigated a lot of these complex cases. So when people ask, like, where did you get experience? How did you work? How did you gain strength and conditioning experience? One, I got it at the Olympic Training Center, working with the strength coaches there. Number two, I got it with traveling internationally with athletes, and then exploring and talking to other strength coaches and how they manage people on the road, which is a whole different ballgame, because you don't have the same equipment. You don't know what gym you're going to do. So you have to work on fitness and strength while in season, without knowing what you're going to have at the facility. So that's a different story. But for this case, this one really put me to the next level, because their strength coach was working remotely. So I had to work on templates and programming. Everything's online, and we're working on trying to blend a mesh of my rehab with a little bit of their strength early on. And then you just kind of have this gray area where we start to phase into strength. And when you work with really good, talented people who don't have an ego, they're more willing and likely to allow you to have more space within their realm, because they have no ego. It's about the athlete. And when you meet people like that, you got to hold on to them. You got to stay connected to them, because they're very rare in like the sports medicine world. And so when you get those people, you kind of almost have to feed off of them, and you just got to learn from them, right? Like I know you're giving me wiggle room, but like, can you help me out here? And you have two vulnerable people who are very open. They're like, oh, we're here to help each other. And the athlete's like, man, I love you guys working together. That to me is like the best team approach. So with this athlete, I ended up, their surgery was in October. Okay, the surgery was October, and September. I got them in October, and they were 2 weeks out, and they needed to be pain-free, full range, able to load by January 1st. So I had 3 full months to get load. So finalize all the movement, get all the ranges going, and then be ready to accept load. Well, then when we look at the last 2 months, if we go backwards, the last 2 months of strength conditioning. So if we look at the CrossFit Open, the CrossFit Open typically in the past was in February. And so when we look at programming, you're usually tapering by mid-February. So that means the last phase from January 1st to mid-February, 6 weeks. That's usually a tapering phase. So you're working on power output, you're working on skill, you're working on gymnastics. So it's high intensity. So the trouble is that we had 3 months to be able to build strength, but it was going to be this gray area to be able to accept load at higher intensities, to be able to transition them into a power gymnastics phase right before the CrossFit Open. And that timeline is very, very tough. So when we took on the case, I spoke with surgeons, spoke with the previous PT, spoke with the strength coach. And when we look at the timeline, it's a very, very tough one. However, we have a high training age, and we have somebody who has a history of pain. They know how to manage it, and they're very motivated. So that alone, and when you work with professional athletes, there's just something about their genetics that allow them to heal, maybe not a little faster, but without less hiccups, might be another way to see that. So this person, we outlined it, and we decided, okay, we're going to go in 4-week blocks instead of 6 to 8 week blocks. So meaning that our timelines were based on 4-week mesocycles or microcycles of how are we going to do this. So when we look at the macro cycle, we had 5 months to figure this out, and we're going to go month by month blocks instead of going 6 to 8 weeks because we don't have that much time. So we really only had 5 blocks of actual work to be able to put in. So the first month was going to be, range of motion, get all the tissue moving, get the blood flow going, and decrease inflammation without a flare up. That was the key. So in the first month, we did get full range to the point where within precautions and contraindications, we were able to. Here's the trouble. When you're working with somebody and you have 5 months and each block is going to be different, at the bottom of the foundational component of this is that you're actually working on fitness in addition to everything else. So when you're strength and conditioning, when you're programming for any athlete, the base of any principle or any program is that they're maintaining some form of fitness behind the scenes. So the hard part or challenging part for clinicians is that you're worried so much about the tissue inflammation, you're so worried about the range of motion, you're so worried about the quality of movement, that they still have to be able to work on fitness at the same time they're progressively overloading. So it's very counterintuitive, because as physical therapists, we want to pull back, we want to do less. The strength coach wants to push more. And then on the fitness side, they have to be able to maintain that. So you have pulling from the PT, you've got pushing from the strength coach, and you have on the background the athlete saying, how am I going to maintain my heart rate? How am I going to maintain my fitness? So behind the scenes, you have to be doing all of that. So as a physical therapist trying to program and be able to blend that all, you have to be able to keep the fitness on the background. So we were trying to figure out, well, if the shoulder's in a sling, what are we going to do from a fitness standpoint? So we worked on, various things that we tried. We did pull work, we did one-handed ski ergs, and that's another challenge too. Is that when you start looking at one-sided asymmetries, you start to get, one upper trap that gets a little bit more flared up. You get, one rotator cuff that's, overused, and that's the challenge too with being able to do all that. So we figured out some basic level of conditioning that we could do. So there was a little bit of rowing, there was a little bit of ski erg, there was a little bit of being in the pool with a buoy, whatever we could do based on where the arm range was. So we tried various things. We can keep some form of fitness. Running wasn't an option until at least week 6, just because of the jostling of the shoulder. So again, we had to work then with their strength coach, and then also they had somebody they're working with on nutrition to help maintain their calories and nutrition on point. So behind the scenes, nutrition and sleep was taken care of. They were rocking that, no problem. So then if we know that's the case, then all we have to do is work with strength coach on fitness, and now we're progressively loading rehab, and at the same time starting to implement what CrossFit style movements could we include before the injured side was ready. So essentially what I did was I got a Google sheet or Excel spreadsheet, and I just went week by week by week, and I just created what were the goal targets, like when could we do pull-ups, when we could do push-ups, when we could do barbell back squats, when we could do front squats, when we could do overhead squats. Then what that let us do was, once we can have those foundational movements, they can deadlift no problem straight from day one, right? PVC or a light barbell, no problem. So once we had a barbell underneath them, that was no problem. Then we had to figure out, how do we get a front squat? How do we get a back squat? Then from there, how do we get an overhead squat? But you have to be able to press that. So we had to do vertical pressing, horizontal pressing, then overhead squatting. Once we had overhead squatting, we knew we can start to load that. They weren't quite ready for the 2 hardest movements, which were going to be snatching and muscle ups. Those were going to be the 2 endpoints that we knew not until January. So months 4, we were going to introduce those things. So we had 3 months to build on the strength. So the first month, the first phase was get the tissue inflammation down, get the range of motion with good quality of movement. The second month, we had no choice, build up muscular endurance. So increase the total reps, decrease the load, and decrease the intensity. So that was just building endurance on that shoulder. Can it handle at all ranges without exacerbating? That's the trick. Strength and conditioning is really just increasing load without increasing flare-ups or tissue tolerance. So first month range and tissue inflammation. Month number 2 was muscular endurance, being able to start to load that with higher reps, decrease load, decrease intensity. Month 3, this is where the strength comes in. And now in an ideal world, you have 6 to 8 weeks to build strength. But when you have short timelines, you don't have that choice. You have to build what you can. So we have the third block, which is the third month. That's where we started to build the strength. So this is where we start to increase the total load. We start to decrease the total reps. So that volume still stays high, but now our intensity starts to increase to moderate intensity. So what you do is you have low intensity, higher volume. You start to increase the intensity, start to drop that total volume. As you start to increase now to month 4, that's where the intensity started to increase, because we had no choice based on the timeline. Now you might say, Chris, that's a lot in a very short timeline. Most of the patients and athletes that I work with might not be able to handle that. That's fine. Just double the timeline or 1.5 or whatever it is. But you have to understand there's progressive overload here. So the first month in any rehab process, just get the range, get the quality of movement down without a flare up. Number 2, build the endurance on that side. So that might be, I'm doing here 4-week blocks, but you might do 6 to 8 weeks blocks. Now, I'm not doing anything differently than the endurance part. I think a lot of physical therapists understand this, that it's really just based on how do I work on my rehab processes. And that's really what rehab is, right? Higher reps with lower load, lower intensity. However, now you can start to add a little bit more load. Now they're in the actual like building of muscular endurance, not just rehab. So this is post rehab. So as we built that endurance with little flare-ups, built the strength, had symmetry by week 8. Now we're on to building the actual like dynamic component of their drills. So the next part was, can they sustain? How many days per week can they stay in month 3? How many days per week can they train without flaring it up? And this is probably the toughest part, was month 3, to be able to navigate. Okay, so we've built the range, no problem, good quality of movement. They now have muscular endurance, they can accept it. The trouble became at month 3, we had to build intensity, slowly build intensity onto it, very, very moderate loads. and building that intensity without flaring them up. So we started with 2 days of intensity, and then increasing that to 3 days, 4 days, until the fourth month, where they can handle 4 to 5 days of intensity at very low repetitions. And the reason for that was because we would rather get them to attempt higher intensity movements without the flare up, because we knew we were putting all our eggs in one basket in the 2 weeks leading to the CrossFit Open. Or sorry, if I said CrossFit Open before, I meant the yes, it is open. Yeah, it's the open part. So basically, where the athletes are competing against each other to make it to the games or be qualified for the games. So the CrossFit Open was there. So all our eggs were in basket were 2 weeks before the event. So we basically only had 1 month to build everything possible, and then we didn't want to risk flaring this person up. So 2 weeks before the event, that's where we added in all the gymnastics, all the snatching. Now you can say, well, they didn't have enough strength. You're right, but that wasn't the case. Here's the kicker and then qualifier. By January 1st, they already had qualified for they already knew that they were going to do well in the open. The kicker was they had to build from their own confidence. What they mentioned to me was they need 4 weeks under a barbell and gymnastics, so handstand push-ups and handstand walks. They need 4 weeks of that to be able to feel good, to be able to perform in the open at the possible loads that they have to endure. So when did we integrate vertical loading? At month 3, we built it, and then at month 4, they had to be upside down in a handstand push-up. So we worked on eccentrics. Everything we started with was eccentrics, just start to load that and partial ranges, and then going into isotonic movements. So when we based all months backwards, 5 months, could we have done this? I don't know if I could have done this alone. Even now I'm questioning it. I don't know if I would have been able to do this alone, but the great part is I had a strength and conditioning coach right there working with me, and they were open to discussing, when they would blend a lot of things. And here's my takeaways. Number one, programming is life, and you naturally do that as a physical therapist, but what you don't do is you don't apply. You have the framework because soft tissue healing and post-op protocols. But the minute that person is non-injured and they ask you for that same time point, it's like we get scared. We're like, wait, you're non-injured. How do I work backwards? It's the same. You build the time point, the peak of the event, and you work backwards. And for those of you who are in my newsletter, you should have received my newsletter that just came out that talks about the mesocycles and macrocycles and how to build that backwards. It's really, really fundamental. And working with the strength coach was amazing. And I did a podcast recently with another PT, Zach, talking about how to integrate yourself with these strength coaches or any other medical professionals or fitness professionals. And you can't do this by yourself. First and foremost, you'll get to a certain point. You come to my strength and conditioning summit next week in San Diego, or remote in July 23rd, 24th. I'll show you the fundamentals, right? Like this is just to kickstart you, because I think most of the time in your environment, you may or may not have access to so many patients and athletes that need it. But what you need to do is give yourself a little bit of an edge to be able to blend that integration point to get to that next level. You'll rarely teach skill. That's the technical coach. That is not your job. Your job is just to get them strong and fit. That is it. In the rehab setting, your job is to get them pain-free and moving great. If you're blending the rehab to performance side, then your job is to get them strong and fit. That is your only job. It's not to teach them the skill of their sport. That's not your role. Don't even try it. Next, once you know that you have a limit, work with that strength coach and acknowledge that and say, hey, I can take them to this point, but what I need is, what are your time points? What are your goals? Because then I can work with you on that. That's my first takeaway. Number two, if you looked at this athlete on paper, would you think that a biceps tenodesis could return to full sport within 5 months? Not even that. Actually, can they have full range in 4 weeks? Can they start to load overhead at week 8? And can they start handstand push-ups and handstand walking at month 3? Can they do a full snatch or a full clean and jerk with low to moderate load at 5 months? Those are very hard questions. Prior to seeing this athlete, I would have said, no, not possible. Now I'm working with this athlete, I've realized that there's a couple things that need to happen in order for this to go. The first thing is that athlete needs to know the entire outline so they can see the map and internally know what those targets are. Once they know what those targets are, but then they will make that decision of, is this possible for them? Because they know it. You don't. You can see it on paper, but they know what is going to be required for them to achieve that. But in order for you to know those targets, you should have already communicated with the physician to let them know, do I have more wiggle room to push the envelope based on this person's targets? If they say yes, then you've got full throttle there. And now you ask the strength coach, do I have your blessing and permission to be able to push the limit? And I'll work with you on doing that. Can I take control all the way up until this point? And they say, yes, perfect. Now you create those targets. Then you communicate that to the athlete. So now everybody's on the same page. That is required before you present that to the athlete. Then the athlete has to decide, is this possible for them? And are they ready to handle the trauma that is going to go into this crazy rehab process? Now, how far in advance did I program all of these things? So I built out the macro cycle, the start of day 1, post-op. As they were talking to me, I was writing everything out. That night, I went and looked at, how is this all going to work? What are my main lifts that I need to work on every phase? So if I knew that I knew what their strengths were, and so we focused on the weaknesses, because if we knew that they weren't good at all, we knew we had to at least get that back up to baseline. So some of the things that they were going to have a struggle with was that their load tolerance was always a challenge. And now when you have a repair or shoulder surgery and they're now weak, and you add that on top of their weakness, it's that's going to be their main area that we need to focus on. So we worked on all the weaknesses. Their strengths, we were just hoping that was just going to let it fly, and it actually worked out very well. So I would focus on weaknesses leading up to the event as much as possible, so they have that confidence, because they already know their strengths. So focus on the things that they're not confident in to allow them the opportunity at least to feel good leading into that next phase. So I found what their main lifts were for every single phase. I knew the approximate percentages that we needed to get up to about 85% leading up to that last phase of month 5, just so they felt good with low loads to moderate loads. Once I knew all that whole design, how many weeks in advance did I do it? Honestly, to be honest with you, I did it every month. So I knew what the macro cycle looked like. I knew that I had 5 months, and I built the templates from off of that. But honestly, you kind of have to go month by month, and then you have a general outline week to week, but that might change based on aches and pains that pop up, I slept on it wrong, so now I have to have a plan A, B, and C based on every single week. But I knew my monthly targets. I knew at the end of the month I had my range that has to be full. At month 2, I knew that I had to be pain-free, able to do 3 sets of 15 overhead with a dumbbell to be able to progressively load to start pressing vertically and horizontally, whatever your metrics are. As long as those are achieved, so you're going to have week by week, bumps, that things that go great and not. And the athlete has to see that at the end of the month, these are my targets. You have to hit them in order to advance to that next level. So I built out my monthly targets. I knew working backwards what the monthly target had to be. Then I would just month by month build out week by week blocks of microcycles so that they understand, hey, there's a little bit of wiggle room in here. Here's what the next month looks like. So you can generally just give them what it looks like, and they can say there's a little wiggle room. So based on any bumps along the way, we have a little space here. So don't freak out if things don't work out. And the athlete really appreciated that. And I took that from the strength coach. I literally had to ask them, how do you build out your programs? And literally that's how strength coaches do it. Even if you're at the professional level, they always have to account for people who don't feel good, who've got the aches and the pains and everything else. You got to have plan Bs and plan Cs. And that's how you have to figure that out. As a physical therapist, that's very hard for us because we're type A. We want to have everything mapped out. And that's when we don't have plan B and plan C. That's where we go wrong as a profession and as clinicians. So understand that there's going to be a little wiggle room, and you go month by month and then week by week, and then just know it's not going to be ideal. So just have your monthly targets and adjust for that accordingly. So at the end of the third week, that's when I start to build out for the next month, because I knew if I hit my targets, then I can plan for that. So I went, I knew what my monthly targets were for every single phase of all 5 months. Then I worked backwards, and I only programmed for 1 month in advance. Keep it simple. And every single week, I had a general idea of my percentages and the movements that the most important movements that I wanted. And from there, I just made accommodations. So that allows you a little wiggle room and allows the athlete to not be overly focused on, if they don't achieve this percent, we're going to be in trouble. Don't do that. So have a little freedom and little wiggle room there. Work with the strength coach, work backwards, make sure that you've communicated with the MD and the strength coach that they've given you the green light. You're now the head chef. You can now work with that athlete. And clear, transparent communication with the athlete is necessary. So this athlete, we got along very, very well. And you have to remember, it's your job, right? You're not there to be their friend. You are there to help them get to the next level. Sometimes there's going to be some rough patches along that way, and you're there to guide them. And sometimes it's very easy as a clinician to get really close to people, and you feel empathetic and you do these things. That's no problem, but you have to stay objective if they are to hit the next course. And so you have to have upfront conversations about, well, hey, I know you didn't hit this target. It's okay. Here's what the next plan is, instead of being, overly sympathetic and just letting them know you're comforting them. But you also have to give them realistic targets. Like, if we don't hit this next week, that can delay the next 3 weeks, and we're going to back off. It allows them to refocus, because sometimes they will push the limit. They'll keep pushing. And sometimes you have to be honest to shut them down. If you continue at this rate, you're going to be 2 months behind. You will not hit your target. So you need to calm down. No more outside extracurricular stuff. I don't want you practicing extra. No more extra reps. If I said 5 reps, you only get 5. We are a team, and you have to be honest with me, and I will be honest with you. And sometimes it's a hard conversation to have, but you have to understand your role. They will thank you at the end of that, that when they're on the podium or they're in the competition, whatever it is. So what happened with this athlete? What was the result? They actually did great. They went into the Open and they qualified for the region, and I was ecstatic / nervous. I was literally biting my nails every single time. It's I always describe when you're rehabbing somebody, it's like painting a picture, right? Or you're making a cake, whatever that is. Like, you're adding layers onto stuff, right? And you're painting it. It's so beautiful, and you're doing it great. And then an athlete goes out to sport and they just completely destroy it, right? Like, they're like, oh my God, they're so sore, they're all beat up and everything else. But the point was not to make a perfect picture. The point was just to be able to get them onto that podium, just to get there, just to see what it feels like. And you did your job. And so I watched this person on TV, and it was amazing to watch them compete. And they did make it onto the next level. They actually made it to the CrossFit Games afterwards. And the hardest part was just getting them to month 5. Could they do all the gymnastics work without flaring up the shoulder? When you look at, a biceps, they're probably gonna, and it was a proximal biceps, sorry if I didn't mention that, but ultimately the hardest movements that they're gonna have is probably a snatch or muscle up, the top 2 movements that will aggravate that thing. So that's why we saved those 2 movements to the very end. We practice them, with PVCs, bars, empty bars, resistance, manual resistance, all, you name it. And you don't know what it's going to tolerate until you get to that point. And this is also a lesson I learned, that sometimes an athlete will tell you, they're post-op and they feel like they're ready to return to sport. And you ask them, like, well, like, what's your percent? Like, how close to 100% are you? And they'll usually say 90, 95, 98, 99. And what I've realized, and I teach a lot of physical therapists that I mentor, that the difference between 100 and any other measure in the 90s is actually playing and participating. So you can have somebody who is like, I'm 92% and they're 6 months out. You can have somebody 95% and they're 10 months out. You can have somebody 91% and they're a year out. But the difference between that and 100%, that last little bit, if you just struggle with them, like you're strengthening them, you're doing all these things, and just confidence doesn't go up, you've done all the battery of ACL tests or whatever it is that you do, and they just don't get over that hump. And the reality is they need to be in the sport to feel the energy, feel it. Somebody bumps into them or slides into them. They're like, oh, and they're really scared and hesitant. Sometimes it takes that to get them to that 100% mark. And you can't do that. You can't replicate that. That's not something you're going to do in the clinic. You can do it as much as possible to try and mimic it. But a lot of times that last little bit is that 100%. And that's what happened with this athlete. So I was very appreciative of the case. I love it. I love these cases. I love complex, high-level cases that are very short in timelines, because the thing I've learned with rehabbing professional athletes and people in my community is that if I can make it happen on paper, I can make it happen. But most physical therapists that I see won't even try and do it on paper. They'll just kind of go with the wing it, like the let's see how it goes framework. And they're like, yeah, I've done that before. It's not about whether you've done it before. Does it make sense on paper from a soft tissue healing standpoint? And if you can make sense of that and that looks good, then you can explain that to the athlete, and then there's a little bit of that gray area and wiggle room. So off of this athlete is a professional CrossFitter. They were actually, somebody asked me this, how old were they? I think they were in their late 20s, early 30s, and early 30s. And, so their tissue tolerance were to a certain point, they still needed a lot of rest and for their body to be able to function properly. So as I mentioned, sleep and nutrition was taken care of. Their fitness was taken care of with their strength conditioning coach. My job was to rehab without irritation and increase load to bridge that gap with the strength conditioning coach. So what doors does this open for me? Fortunately, that strength coach then connected me with a lot of athletes at the high level who needed the same, who had post-ops and needed help with programming. Where could they go? Whether it was a knee, a shoulder, or back. And it was a really cool time in my career where I had all these CrossFit athletes that were high level, post-operative, and they just needed that edge to get to that next level in terms of programming. And I was the bridge between the strength coach, who just couldn't always modify, because when you integrate a behind the neck clean and jerk, when do you integrate a snatch balance on somebody who has a rotator cuff repair or has a discectomy? Like, when do you load that? I mean, what are the basis, what are the timelines, what are the things that are needed? So for years I did that. And as my practice grew at sports performance physical therapy, it became very, very difficult to manage. So I discontinued it for a long period of time, and I miss it. And so that's why I'm bringing my strength conditioning summit back, just to share those principles I've done. And the cool part about programming is that you can do it remotely. If you have patients and athletes that are they leave for the summer, or they're going to be away on vacation, or whatever it is, that you can build programs beforehand. And the great part is you can track it, right? So as long as they have a shared document with you, they can always track it, and you can always see on the back end. And so that allows you to have an extension from being previously, as physical therapists, we were just like, you had to see us in the clinic. But what this does is it creates another arm for us. It allows us to connect to that patient and athlete remotely. And within, if they're not injured, it allows you to just take them to that next level until they can find another resource, or if you're going to be that point person. And that's how my career started in strength conditioning. It's just literally, this is how it all adapted. And I miss it. So if you're like, oh, man, Chris, I want to do that. I want to be that point person. I want to be able to have those challenges. Then I'd say join me either in person or remote at my Strength Conditioning Summit, July 23rd, 24th. If you're listening to this, it's 2022. If you're interested, I do have a webinar coming up on Tuesday that is completely free. If you're interested in that, that's just going to be kind of a sneak peek what it's going to be like into the summit. So send me an email if you don't know about it and you want to know more. Dr. Chris at drchrisgarcia.com. Yeah, I had to share. This was one of my toughest cases as a professional, and I still get them. They're all of them are tough. It's just the timeline, and then the motivation. What's the soft tissue healing feel like? And then ultimately, who am I working with? If once I know those things, my needs analysis, then I just put it on paper, and if it works on paper, it will work. You just got to work very closely with athletes and people, like your multidisciplinary approach. And the goal here is to not flare people up. The goal is to build strength, but a lot of people can do that. but without messing them up. That is the hardest part. That is like the toughest thing. And I've split 3 PTs apart, and I um, don't get mad if I say this, but there's 3 types of PTs that I see. There's one who just is afraid to load them, and so they work on quality of movement, and they work on movement, and they work on movement, and they work on movement, and they only like put a little bit of load because they want to like focus so much on movement. This is like the glorified home exercise program PT. Then you have the PT in the center who like they can get a movement, like they can build their endurance, and they're willing to take them onto the strength phase, and they love it so much that, and the athlete's pain free, so they load them. Like they just put on the load, like they excessively put on the load, and they fail to realize that that person needs to be able to participate. We're not rehabbing and strengthening just for fun. We're rehabbing them to get to a specific point in exercise or fitness. So you're not rehabbing and focusing quality movement to get them to just do nothing. You're doing it to get them back to something. And if you just load them and go, they're not, like maybe they're a power lifter, that's different. You're training them for that, but you can't put a soccer player and just load and go and focus on that. So that's the load and go PT, somebody who just applies the weight and not afraid of it and just do it. And the last person is the person who can do the movement, and then they get them out of that phase. They built up really good endurance, and they build the load. They get the athlete to handle the load, and then they can't get them to the next phase, which is that power phase. So getting the nervous system and their tendons ready for high intensity sport. And they're reserved about it, right? So these are the, I'm just a little nervous, or I'm just a little afraid PT. They don't want to let them go into that last phase. But either way, along the spectrum, you'll find yourself in your career. I put myself right in the middle sometimes, and I'm always in the gray area. I focus on movement, but I'm not too obsessed with it anymore. I think that if you focus on that too long, it'll take you years to be able to move an athlete to where they need to be. And if you load and go, if you don't load and go, then I think that becomes a challenge too, because that athlete has to have sufficient strength to be able to increase force. So if you don't work on strength, that's a challenge. If you load them too much, you make them sore, they can't go to practice. And so you have to integrate them into that power phase. And so the power phase is very tricky because you can flare them up. And that's where the tricky part is. What are your percentages and how many reps and total reps are you doing? How many plyos you're doing? Quality control. So knowing that phase, I get why PTs are reserved about that, because it's one of the trickiest phases that you don't get a lot of reps in, and it's actually one of the most time sensitive and risky ones. So I understand why PTs do that. So we'll talk about that summit. If that's for you, I'm excited to see you. It's drchrisgarcia.com/summit. If not, I will see you at the webinar, drchrisgarcia.com/summit-webinar. If not, I will see you at my foundations course. I think that is in September. I can't remember exactly when, 23rd, 24th, somewhere in there. If not, then I will see you on the next episode. I hope you guys are doing amazing, and you guys are enjoying the summer of 2022 and not getting black eyes. All right, guys, I will see you guys on the next episode. Take care.